So the story of HIV is a story that is deeply tragic, but also very inspiring. And I think if it's told in the frame of the then and the now, we can see how far we've come and how far we still have to go. And this is a famous picture by Tom Fox of a family mourning the passing of their loved one in 1989. And it I think captures the collective grief of a generation over the losses suffered from AIDS and HIV. And the early focus of the epidemic, as when and if it brought in women, was really in this discussion of women as vectors of disease, right? And so the terms that were used that we don't employ now, mother to child transmission or vertical transmission, we use vertical transmission, but the mother to child transmission kind of framing that really focused on and kind of created this image of innocent children getting HIV from women. And women were focused on as a conduit for the passage of disease. And that happened, I think, in the way that research was described, in the way that promotional work around advertising who was at risk for HIV was described. And I think that a lot of that impacts the way that HIV is framed among women now and the way that it's discussed among women now. The story of HIV was really turned around, as we know, in 1996 with the introduction of highly active antiretrovirals. And even with that story being told, you can take a look at these graph lines coming down significantly in 1996. You can see that it differs by different racial and ethnic groups and that those differences persisted even as things got better and better. And so for Black communities in particular, and I'll kind of focus on that as an example because the rates are so high, you can see that they were still more likely to be infected and to die from AIDS complications than their white counterparts. And that was true for men and women, right?